Hello, everyone. It's Ashley with Amare, owner and founder of Amare Healing Arts, Plastic Surgery Recovery Center, and Holistic Clinic, specializing in manual lymphatic drainage. We have two locations in New Jersey, Highland Park and Elizabeth, and I also offer virtual consults. If you're not in New Jersey but still need help with your recovery, you can give the office a call at 732-841-0142 to set up your sessions. We have our post-op shop where we offer post-op supplies like lipofoams and BBL pillows, and I teach you guys how to use those products with the videos that we have on our product page. That's amarepostopshop.com. We also have our online courses where I teach you guys what massages you would need after plastic surgery, when to get your massages, who to get them from, what the lymphatic system is, what lymphatic massages actually are, and all the research that you would need on your post-op massages and finding a lymphatic therapist. All of these links are in our bio as well as in the description boxes, so you guys can go and check that out. I will see you guys soon. Ashley with Amare. Bye. Ashley with Amare. So we're gonna start the live. I'm gonna do to let me know she's ready. Oh, hey! Hi, Boo!
Hi, how are you?
Good. Let me get my glasses. Hold on.
Super. So, because she's not here, I want to let you know she's Moana.
Thanks, babe. I am Moana. You're correct. The ocean chose me.
She's
My big ass boat blocking my Amare sign. So this is a temporary decal. We were sizing it out for like the big one that we're getting made. So it looks ridiculous, but my bow blocks the whole view of it. So we're just gonna pretend it's not there today.
That's a bow and a half. Like that's a.
It's a banana clip bow. I know you love your banana clips.
It's fantastic.
I've been wearing banana clips forever, and people are like, "Oh, it's coming back." I'm like, "But it never left." So
yeah.
Okay. All right. So we're talking about squeeze massage. Ew. Incisional drainage. Ew. Blood and fluid coming out of your body. Ew. Do you want to start?
So I think we could get really technical because I'm not really on the ew bandwagon. I'm more on
Yes.
let's throw some
Do it
facts
safely.
and
Yeah.
and it's like serosanguinous fluid that's coming out of your interstitium. So any confusion, the big thing is the confusion for me. I think that's the thing that really sits on the hearts of a lot of people, especially people who text me, message me very publicly, like it hurts, my natural birth was less painful than what they did to me. Do I really have to have this done? And then like I showed the comment on my video today, like the person is picking the scab, reopening the wound and pushing the fluid out. And it's a combination of that and the pain that they get afterwards that really makes me want to direct people back to their plastic surgeon and make sure that they're actually getting the treatment that their surgeon wants. So absolutely, some surgeons in Miami want you to get your fluid pushed out. Surgeons in Tijuana, surgeons in, the DR, absolutely. I know that happens. What you need to do is if you're in the United States of America, you need to go to somebody that can do it safely and legally. And if your surgeon wants you to have that done, they should be able to direct you to a specific person that can do that safely and within their scope of practice. But the big, huge thing is there is this confusion between manual lymphatic drainage and lymphatic massage and pushing fluid out of incisions. And I want you as a client, as a patient, to have that conversation with your doctor. One, do you want me to get fluid pushed out of my incisions, or do you want me to get manual lymphatic drainage or lymphatic massage, something that will direct the fluid into the lymphatic system? I want you to be very specific. And it's almost like you have to use words to describe it. You can't just say MLD lymphatic massage, because if you go on Instagram and hashtag like lymphatic massage, you can see one at like a dozen different things. So it's almost like you have to make your doctor sit there and explain to you, like, I want it to be a very light skin stretching stroke. It's called the Vater style of manual lymphatic drainage massage. I want this to be a comfortable massage for you. You just got out of surgery, so if you can like barely touch yourself, it's not going to be the most fantastic massage like it will be like 3 months from now. But it also should not be something that you're on like 7, 8, 9 of a pain scale. You're screaming, you're crying, you're trying to like let all that money go and not go back to your third appointment because you don't know how you could possibly have that happen to you anymore. We don't need to cause pain on our clients for post-op recovery. So I want that conversation to happen with the plastic surgeon, especially if you get into the situation where you're getting these massages and someone is picking your incision open and pushing fluid out. I want your surgeon to know that's happening and be telling you, yes, I want that to happen because there's a whole lot of things about you potentially, if you're not on antibiotics anymore, is this reopening and a potential vector for infection? If you're having a lot of pain with these massages, you need to tell your doctor and ask your doctor for the pain relief that you deserve. Do not let someone tell you, oh, you're just a baby, oh, stop crying. If this is what your doctor wants and you're at a pain scale of like 6, 7, 8, this needs to have some pain control written in a prescription from your doctor. And if you're, but what I want to happen is you to have that conversation with your doctor so everyone's on the same page. Whatever they want, whether, it's something that I do as a massage therapist or not, I want you to have the recovery that your doctor is expecting you to have. What I don't want to happen is your doctor says, yes, like lymphatic massages, my other clients have gone. They've said it's fantastic experience. They went down in their faja. They're so happy. And then you go to somebody and you think that you're getting the same thing that your doctor thinks that you're getting. And instead you're not. Instead you're getting something very painful. So if they're reopening in your incisions and pushing fluid out, this is maybe a totally different from what your doctor wants you to do for your post-op, especially if someone wants those scars to heal up and they're nice and small and almost disappearing. Like I have a liposuction scar on my body and you can't tell it from another like mole or freckle. And I was not reopened up and fluid pushed out. So I'm thinking that I want to get the message across that you need to have this conversation with your doctor and you both need to be on the same page, exactly what the massage happens during the massage, not just the name of it, because we're very confused on the name, what the pain level is, if you need pain control, and what if incisions are being reopened or there is some kind of risk for infection, if you're being taken care of. Some of the comments that I've gotten on my TikToks are just unbelievable going into the hospital, and I'm sure that's like an outlier, but that's what I don't want for anyone who's listening now. I don't want you to be, because we didn't ask enough questions before the surgery and we got into a post-op situation that the doctor doesn't know it's happening to you. So that's my soapbox.
So here's my thing, right? So we're gonna riff on something a little bit here. So we're gonna start with, we're going to get surgery in Miami. Okay, cool. We start doing research on TikTok and Instagram and YouTube about my journey. You Google your doctor's name and you get a video of somebody who went there and did a thing. Yes, there are surgeons in Miami who want you to get aspiration done. So there is a difference between squeeze massage and aspiration. So if you have a seroma or a pocket of fluid, a nurse or a doctor is allowed to use a syringe to suck the fluid out. A massage therapist is not allowed in New York, New Jersey, California, and a couple other states. It is not allowed for them to cut open your incisions or stick you with a needle and squeeze and have blood and fluid coming out of you. That is not legal for massage therapists to be doing. Yes, I understand they do it. Yes, I understand it's offered widely. Yes, I understand that everybody's doing it and oh my God, it's so painful, but I did it and I'm so snatched. I get it, but legally it is not allowed. Also, biologically, that's not how swelling works, because you guys will go and get the squeeze massage and come to me when you get home in New Jersey and be blown up and be fibrotic and be in pain and be crying. And you're like, I spent all this money on these squeeze massages and I'm still swollen. Why didn't it work? Because it's not addressing the swelling the way your body is meant to take care of swelling. It's squeezing out, like Kathleen said, that serous fluid that's in your tissue. Now, again, there are a lot of surgeons that want you to get that done. We at Amare always say, go with your surgeon's orders. Ask your surgeon if they want you to get it done. Like Kathleen said, talk to them and be like, okay, why do I need fluid squeezed out of me? And they're going to say, for the swelling and to make sure that you don't build up any fluid. Okay, can I do Vater-style manual lymphatic drainage instead? Can I get the hands-on gentle MLD instead? And talk to them and ask them if maybe that's something that they can do. Maybe they just don't know. Maybe they're just not educated enough to know the difference between the squeeze massage and manual lymphatic drainage, because they think it's all the same lymphatic massage. So you go there, and you know you have to get these massages. You see them all over the place. And like Kathleen said, you guys go and look, lymphatic drainage massage, and see all of these squeezy, crazy things that are not manual lymphatic drainage, not addressing the lymphatic system and getting your body to absorb the swelling so you pee it out. It's not any of those things. So you're seeing all that, and you're like, oh, okay, well, this is what I need. And then your doctor says, yeah, get lymphatic massage. And you think, oh, it's the stuff I saw on Instagram. I got to go get squeezed. They're not the same thing. So it starts with, I'm going to get surgery. I know I need massage. Lymphatic drainage massage on the interwebs. And that's where the confusion happens, because before you even get to your surgeon's office, you guys start seeing all this stuff and think, oh, well, this is what I need. Oh my God. I say ew because a lot of my clients are like, ew, that's so gross. I have to get that done. Again, you don't have to. If your surgeon is telling you lymphatic drainage massage, ask them, okay, what exactly is going to happen to my body? This is why I created my course. We just released our course, Post-Op Lymphatic Massage and Finding a Therapist, for this reason. Because you guys go and do this research, and it's all YouTube, Instagram, Facebook groups of people getting the same illegal thing done by massage therapists that are cutting open your incisions with a Q-tip or a toothpick, pushing needles inside of you, like the post that I just shared the other day. All these things that are not legally allowed for massage therapists to do. It's not about right or wrong. It's about what we're allowed to do and what we're not allowed to do. So it's not, is squeeze massage right? Is squeeze massage wrong? It's not, should I get drained? Is that right or is that wrong? It's, is it legal? If a doctor or a nurse has a syringe and is pulling fluid out, draining a seroma, if a doctor or a nurse is doing some sort of aspiration where they're gently moving your skin and fluid is coming out, they're doing this and the fluid's coming out, that is a different story. If you're talking about going to someone who doesn't speak any English that you can't communicate with, you have no idea what's going on, they're using a Q-tip cotton swab thing and poking open your incisions, and you're screaming in pain as they're raking their hands through you, that is not the massage that you should be getting. You should be getting manual lymphatic drainage or whatever your doctor's recommending, but not all of this crazy stuff. So if you are going for surgery in Miami, ask your surgeon, like Kathleen said, what you're supposed to be doing for your massages. And now a lot of them in Miami will say, just go get lymphatic massage. If you do the proper research, the medical research, and you go to Google instead of all these TikTok, Instagram-y places, and you take our course, somebody who is, like Kathleen and myself, a certified manual lymphatic drainage therapist working with post-op day in and day out, someone who knows how to explain this stuff to you guys, if you're getting the information from a reputable source, something that's fully explained, soup to nuts, like the course, especially like, what is the lymphatic system? Where does swelling come from? Why do we need massages? Like, what massages are we supposed to be getting? What are they supposed to feel like? If you're doing that research, That's different than just, like Kathleen said, sliding in the DMs late night, looking up lymphatic massage at 2 a.m. because you can't sleep and you're trying to like find things about surgery rather than doing research on something like the course or like Kathleen's book or things that are reputable. So that's where it starts. That's where it always starts, because your surgeon is going to say lymphatic massage and you're going to get confused, or they're going to say, oh, we have someone here that does it. And then they're cutting you open and squeezing fluid out of you, and they're a massage therapist and not a nurse and not a doctor. And you don't know what's going on. That's not okay. That's not what you want. This whole like squeeze massage, incisional drainage, again, it's not about right or wrong. You cannot control what other people do. You can only control what you get done to you, what you allow. So doing the research is the biggest part of it. And that was the whole point of the course, is so that you guys aren't late night doing things on the interweb and the dark web, looking at crazy videos of things and people saying, oh, it hurts so good and I'm so snatched. And then like they have all this fibrosis. They have a seroma and they have complications and their incisions are crazy and they're 8 months out still wearing a garment, like all of those things. But because everybody's doing it, but there's no one like Kathleen and I, which is why we're doing this video, like pulling it back, grounding it down, and giving you some kind of context for it. Just because you see it out there doesn't mean that it's right, doesn't mean that it's okay. And again, like Kathleen was saying, there are people that are licensed to do that. There are people that, like surgeons, that want you to get that done for a specific reason. That is a different story. That is not what we're talking about. What we're talking about is finding someone who is not a nurse, not a doctor, not in a medical practice, pulling your drains, sticking you with a syringe, cutting open your incisions, pulling at your scabs, cutting your stitches to get the fluid out. I heard that the other day from somebody and I almost lost my mind, because that I think that's like the worst that I've heard. Because if you have a scab, okay, they're poking it, they're cutting it off, that's fine. You take a scissor and you cut somebody's stitch to squeeze them and get fluid out of okay, guys, you need that fluid. I teach this in the course. Why do you swell and why do you need it? You need that fluid. It is healing juices. It makes sure that you heal, but you also need to make sure that you're taking care of the swelling at the same time. Like, you can't just have one and not the other. Like, people have passed out from this, guys. People have been in the hospital with anemia because of squeeze massage. It's been a thing, and infections. Please be safe. That's the point of this video, is that it's crazy out there. And you guys got to do your research in the right places and talk to your surgeon. Ask more questions, please. Ask all the questions. But I'm done ranting now. You can go ahead.
And you need your stitch. Like, there's a reason that there's a stitch in your body.
Thank you.
Your surgeon is going to figure out when you need to take that stitch out, because we're talking about having a thin, a light, a beautiful, a small, a scar that no one can see from like across the room because someone opened it up. You know, we don't want a jagged scar. We don't want it to be really thin and then like really thick, because that's where, you know, the fluid came out. The other thing I really wanted to get past is because I have a lot of people who are massage students who are coming to me, and people who are learning MLD and coming to me. And I just want to say, like, for both, I think I can say for both of us, like, I have helped clients. This is my job. I do it full time. I have doctors refer to me, and I've never pushed fluid out of incisions. It's not a part of my practice. It doesn't need to be a part of my practice for me to be successful and get clients to come. So I'm heartbroken to think that there's someone who wants to go to massage school and help people, but they're scared because they don't want to do squeeze massage, and they think if they don't push fluid out of incisions that they can't help people after plastic surgery. And nothing could be farther from the truth. I have board certified plastic surgeons referring clients to me, and there is no reason that you have to go outside of your scope of practice in order to help these clients, especially if they're referred to you by a competent plastic surgeon that's doing the right procedure on the right person at the right time. And the more educated that people are, the more that they will come in knowing exactly what they want done and not want done. And I actually had a client come in to me today, and she came in for one visit, and then she went for the post-op visit with her surgeon, and then she came back to me today for the second visit. And she said, you know what, when I told the surgeon I was doing lymphatic massage, you know, they started like reading her the riot act. Like, that's okay, as long it can't be one of those painful things. It can't be too painful. It can't, you know, it can't be like this. It can't be like that. And I was like, that's great. I was like, oh, and what did you tell him? And she's like, you know, I told him I was going to Kathleen, you know, and I told him it was comfortable, and it was a massage, you know, it wasn't the most relaxing thing I've ever had done in my life, but it was nowhere near these painful stories that people see on Instagram. And you can have the full recovery and not have to go up to a pain level of a 10 on all of your post-op massages. And I do see comments from people on TikTok that are like, that's one of the reasons that I won't have plastic surgery, because I don't think I can get through the post-op. And that's just, it's a shame that people can't be empowered to change themselves because they're so scared of the painful recovery.
Well, again, that's why I made the course. That was the point, because I have so many people on virtuals in my office for pre-ops that are like, I'm so scared of the pain I'm going to be in from surgery. I'm so scared of the massages I'm going to have to get. And the find a therapist part of my course, I can't find anyone that doesn't do squeeze massage, and I'm scared. That right there, you don't ever have to worry about that again, because in the course, I give you the clickable links to the therapist directories, and all therapists are licensed, because you can't take these classes without being licensed, and certified in MLD. They may not be post-op, but in the course, I teach you how to direct them so they can do what you need after surgery. Because not all MLD therapists are as deep into the plastic surgery world as Kathleen and I are, and have as much knowledge about these procedures as Kathleen and I do. So the first part of the course teaches you, hey, this is never supposed to be painful. Here's why. Your lymphatic system works like this. Your swelling is created for this reason. This is what your body uses swelling for. This is how your body gets swelling out. Here's why your swelling's not moving after surgery. Here's how we get it moving with manual lymphatic drainage after surgery. What is VOD, manual lymphatic drainage? What is it supposed to feel like? When do I start? How do I know it's working? How do I know when to stop? All of that. And then, how do I find somebody who's doing the actual massage that's going to get the swelling out, that is licensed and certified, that will not even know what squeeze massage is, that is going to make sure my swelling goes down, that it's not going to hurt, that has that anatomy background, that has that knowledge, that has that understanding of how the body works with swelling and how to get rid of it. Guys, the overall point of like the course and everything that we both offer, your manual lymphatic drainage, your lymphatic massage, your post-op massage does not have to hurt. Your massage does not ever involve fluid leaving your body. That's not a thing. And if you don't know what massages you need, we go over it all in the course. But that's not how it's supposed to be. And it's like, you for the therapist perspective and me for the client perspective, it breaks my heart when you guys come in and you look terrified. You look so scared. And I do everything. I do these lives. These videos are on my website. They're on the YouTube, Instagram, TikTok, everywhere, to tell you guys and like let you guys know, like, it's not supposed to hurt scientifically. It is not designed to hurt at all. It's not supposed to. Guys, MLD, manual lymphatic drainage, is used on cancer patients. It's used on patients that have massive limbs. It's used on autoimmune patients. This is not something that the post-op world made up and decided to like make up lymphatic drainage for swelling. This existed way before that. This is something that has been used for swelling of all kinds and all extremes way before the post-op plastic surgery world blew up. Kathleen and I have been doing this longer than, people have been doing squeeze massage and things like that. I mean, I'm sure they've been doing it for a while, but when it got popular, we were all like, what the hell is this? Because we've been doing it for medical reasons for other people forever. And that's never been a thing. And the first time I heard about it, I was like, they're doing what? And they're calling it what? And I was offended. I was like, really offended. I was like, how dare you? That is not manual lymphatic drainage. I paid a lot for my certifications. How dare you? But it kills me when you guys come in and you're like terrified that it's going to hurt. I'm like, no, it's never supposed to hurt. Will you be a little bit sensitive the first session if you're 48 hours fresh? Will it be a little bit uncomfortable if your skin's being touched? But that's why I always say, wait until you are comfortably getting in and out of your garment before you come into the office. Because if you can comfortably get in and out of your garment, or comfortably, but if it's not like your skin feels like creepy crawlies everywhere and you're freaking out, then you're okay. And you can come in and you can handle the light, gentle touch. That's all it is. If moving your clothes across your skin, that's my perfect indicator. If moving your clothes across your skin is like, holy crap, my body's on fire, you're too sensitive, give it a day, give it 2 days, and then come in. But if moving like a strap of a tank top across your skin is like okay, and it's like, it feels a little weird, but it's like okay, then you can come in, because MLD is less friction and way more gentle than that and feels way better. So you're good at that point. But you're not supposed to be terrified. And your surgery, the hardest part of your surgery should be the surgery. You should not have more pain trying to get these massages done. And again, body contouring, wood therapy, squeeze massage, wait. Then none of that is what you need right now. It's not a no, it's just not a right now. And I tell you guys that all the time. I'm not saying no to those things. I'm not saying they're bad. I'm saying right now, they're going to do the reverse of what we're trying to accomplish. If you have broken tissue, if you have incisions, you are not taking a wooden roller to your body right now. Same thing with like cupping and all the other things. If you are like in the first week, first 2 weeks, first 3 weeks of healing, not right now. Later, yes. And that's also something I cover in my courses. When can I start those things? When can I do body contouring? When is that allowed? When is my body ready for that? How do I know when to do other kinds of massage? Because it's not that these things are bad. It's just the timing of when you need them and where your body's at and understanding why you need them is the important thing. But if you're doing something and it's painful, it's not the right thing. You already went through the pain. You already had the surgery. You already spent the first week in bed in pain. The pain should not escalate from that level. It should decrease. And if it's not decreasing, if your massages are escalating that pain, you're not doing the right kind of massage. Go get the course, watch the 7 hours. You'll know everything. You'll find a therapist, and you'll be able to direct the therapist. Because I think that's a big thing too, is that your therapist, your nurse, whoever's doing your Vater style MLD, you cannot expect them to know everything. It's not always their specialty. It doesn't mean they're a bad therapist. It just means that they may not know enough. But that's kind of your job too, is to be super well informed about this going in. And it takes away all the anxiety. Like, Kathleen, how many people have you had come in where they're like, I'm just so overwhelmed, there's so much going on, or how many comments on everything and messages do you get like, I don't know where to start, there's so much conflicting information. How much of that information is actually real? How much information of that is backed by science? How much information of that was told to you by a valid person that has a license or training to give you said information that is backed up by science? Because that's where the confusion comes in, is you guys are getting this stuff from all over the place, and then you're super confused. So I get that all the time. And I'm like, well, it's simple. This is what it is. This is why it is. It shouldn't hurt. Shouldn't be painful. You should feel good. Your swelling's going to go down. There you are. Now, like, yeah, but what about this? But I heard about this, but I saw this. They said, that's my favorite line. They say, immediately I go, who is they? And they laugh. And I'm like, no. Seriously, who is they? And they're like, oh, this person on YouTube that did a My Journey video. Did that person have any post-op training? As far as medical post-op, like manual lymphatic drainage stuff. And they're like, no. I'm like, okay, so then that doesn't matter. Yeah, you guys can ask questions. That's why we're here. Like, that's why the comments are up. You guys should be asking questions. We're just waiting for you to ask questions because nobody's asked anything. I had a sticker on my story today asking for questions. Kathleen, do you want to ask your question now?
I would like to read somebody's like graduate thesis on hey.
I will write a thesis on the psychology of hey.
This like, and there's actually an interesting, I'll only go on for like 30 seconds, but there's an interesting backstory on hey had originally a completely different personality, and they were going to throw him out of the movie, and then they changed the personality and put him back in. So that's like some deep Disney trivia for you, which I love. So
proud that you know that. That makes my heart so happy.
I'm all about hey. All about hey.
I love it.
I have Mickey ears. No, I have Tiki Mickey ears. Yeah, I did not
okay.
I have Tiki Room is my favorite. So yeah, someone please ask a question, or else I'm gonna keep on talking.
We're just gonna keep going. Like Kathleen and I can go for hours. That's the problem. We asked you to ask questions.
So what I would also say to what you were saying earlier is like I have naloxone at the office. I took the Narcan training like 2 years ago, and I have to have a prescription like naloxone in my office in case someone overdoses on opioids. And I'm super serious about that because people come in and you can see, because like you can like feel the fear emanating, the anxiety emanating from them, and their eyes are a little wide, and they have this really shy question like, how much is this gonna hurt? And I feel so honored that they're coming to see me, that they trust their doctor that much, that their doctor said they should have that they will come and see me even though they think this thing is going to hurt as bad as they've heard at midnight on YouTube. And I tell them like, no, it doesn't hurt. But I'm still scared of the time when someone takes an extra, opioid because they think it's going to hurt so much they're going to scream, and they're going to faint, and all these things that we see so often on the internet. And it's super telling that when you see the most often, I kind of noticed this, and once I mention it, maybe you'll see it too, but when you see the videos of fluid being pushed out, it's always a song. It's never the actual audio of the therapist talking them through the treatment. And it's not necessary for you to have recovery. I don't want anyone to put off a surgery that would really help them because they think they have to somehow go through this. And a lot of my clients, a significant, like a quarter at least of my clients specifically mentioned to me that they want to do as few like almost no narcotics, and as few pain relievers as possible. They really want to focus on having low level of pain relievers, get off pain relievers as soon as possible. They don't want to stay on those drugs for a long time. And I want to honor that and let them know that not one, but actually several studies on MLD have shown over and over again all around the world that it's the level of pressure we use, and it's the rhythmic movements of the MLD, and it's everything else, all of the placebo that I have in the office. Like, it looks like a massage office, it smells nice, I have the soothing music on, there's dim lighting. Like, this is a perfect opportunity for someone's parasympathetic nervous system to come, for them to have a very calming treatment, for them to feel comfortable, for me to ask and answer the questions so they feel more confident that another person's looking at them. And they'll have these questions that they're too shy to ask their surgeon, that they can go ahead and ask me. So the whole experience, they leave more confident. They leave having urinated, which is how the swelling leaves the body. Like they have to go and pee, and then they come and they feel softer. They feel more able to move. They're able to do their activities of daily living, like toileting, like moving more easily in their torso. They don't have that tight feeling like saltwater taffy. Their garment fits looser, and they can sometimes get in that smaller hook, or they're able to put their full foams that the doctor really wants on them. It's just always a beneficial experience for the client. And they go back to their doctor and they talk about that beneficial experience. And that's how I get the doctors to refer to me over and over, especially when the doctor sees like this would be like an ideal client that would really benefit from this. Somebody that's interested in holistic healing, somebody that likes, you know, organic food and exercising and keeping their body as healthy. And the plastic surgery is an extension of, like, I want to look on the outside like I feel on the inside, like they're doing all their work to care for themselves holistically, and they're coming to the doctor for help to continue living their best life. And so lymphatic massage would be an excellent part of that post-operative process.
And the other thing too is, like, you guys do the massages because you're worried about your results, right? Which you have a right to be. You're paying a lot for this. Some people saved for years. Like Kathleen said, you guys are working out like crazy, changing your diet, eating healthy, getting healthy, and you're saving all this money, and you want those results. And those results start from the inside. But then you get your surgery done, and because there's so much back and forth about what lymphatic massage is, it's manual lymphatic drainage, you guys wind up doing these aggressive, deep, painful, cutting open incisions, squeezing fluid out, causing scar tissue massages, and then say that the surgery went bad. It's not the surgery that went bad. You did all these things to cause more tissue damage and thought it was going to help because you saw it online, but you didn't do the research. You didn't have somebody guiding you to tell you what you should be doing for your recovery as far as your massages and explaining to you the science of what's going on. And like Kathleen said, in the room, like those videos, you never hear anything. And when you catch videos from people that have done it, hi Samantha, when you catch videos of people that have done it, like you hear them screaming in the other room. But when you guys are trying to like figure all of this out, you're trying to protect your results, and you're doing that by panicking because you have nowhere to get the proper research from a reputable source with all of this in one place. And then you wind up doing the massages that are bad, and then you wind up saying the surgeon did the lipo too aggressive, or saying that like the surgery just didn't work. It wasn't that. It was all of the stuff that was breaking your body as it was trying to heal. That's what's causing the issue. And then, again, there are a lot of people who are on, you know, the incisional drainage bandwagon thing that are like super, super defensive and gung-ho about it. But when you try, back to like the hearing them talking thing, when you try to ask them, okay, medically, how is this working? Okay, how is this working for my body? Okay, what are you doing? They say, oh, we just got to get the fluid out. That's not a medical explanation. That's not a scientific anatomical explanation. What is this fluid? Where's it going? Like, I get it's coming out of me, but like, why does this hurt so bad? Like, we got to stop settling for like the bare minimum with this stuff. Because Kathleen does and I do in our sessions, I'm talking the whole hour. You're getting the anatomy of your lymphatic system, the anatomy of what just happened to you during surgery. Like Kathleen said, they're opening up to us and they're telling us all these things and asking all these questions that they didn't feel comfortable asking their surgeon or the nurse. Or they asked the surgeon and the nurse, but it left them with like 10 times more questions. So they're trying to ask us, and I'm like, okay, here's what we're going to do. We're going to make a list, and you're going to write it down, and you're going to call your doctor later. And then tomorrow when I see you, you're going to tell me what they say. Because I'm not a qualified professional to tell you any of that. I didn't do your surgery. But what I can tell you is, this is why you're swollen. This is where you're swollen. This is what's helping. This is what's hurting. And we can give guidance on what we're experts on, which is the swelling after surgery and protecting your results so you don't heal with that swelling, and that swelling doesn't become fibrotic or become a seroma and then cause problems and complications that's going to ruin your results. That is our job. That is the point of your massages, not to just get the fluid out and be screaming in pain. You have to ask questions with everyone. You have to be informed. And if you're the person taking care of you that's supposed to make you feel the safest and nurture you through your recovery, if that person is not able to give you that nurturing, is not able to answer your questions backed up by science, and explain it to you and pull up, like I do in all of my videos, pull up the medical journal, show you the science, educate you, you're always going to be scared about ruining your results, and you're never going to know if it's going to come out right. And it may not come out right. You may make the wrong decisions. You may go home after your massage with me and use a rolling pin and dig through your tummy tuck. Why? You have an ab repair and stitches. Don't do that. So I explain it before you get to the doing the bad things part. And I talk a lot in my sessions. And I talk to you guys about this stuff because you see all these crazy things and you have no one on your side. And that's the point of the course. That's the point of Kathleen's book. That's the point of these videos. But when you're talking about massages, you're talking about the person who's supposed to be carrying you through your recovery and helping your body heal. So if it doesn't feel like that, then it's not a good thing. If they can't explain to you the science, then that might be kind of a red flaggy type of situation, especially if you're in massive amounts of pain. If it doesn't feel right, question it and start looking for answers, because it may not be right. And it may not be the right time for that kind of massage. And it may not be the right kind of massage. And the person may not be licensed or certified. And it may be a problem. But you just picked anybody because they had the soonest availability right now, today, the only opening. And you took it because you're so desperate to get your massages because you know that you need massages. So you're going to go with that person. And then you get there and it's squeeze massage in New Jersey. And it's illegal. But they had an opening today and it was $90 for the hour and you need the fluid out. That is where all the problems come in. So we want to make sure that we are talking. And that's the other thing that we offer is the Vetting Your Therapist Guide, which is like 10 questions on the phone to, get the therapist to make sure that they're MLD certified to like talk to you. So it's like a bunch of questions. The link to it's in our bio. It's a bunch of questions as well as those clickable links to like the MLD certification courses, therapist directories. And the questions are gonna get your therapist to actually to vet them, to understand if they know what they say they know. Because that's another big part of the problem. You call the place and you're like, do you offer manual lymphatic drainage? Yeah, we do. Is it gentle? Of course it is. Is it the skin stretching motion? Yeah. You get there, they're using CBD oil, gently rubbing your skin, and then putting a heat pack on top of your tummy tuck. Totally the opposite of what you should be doing with a tummy tuck. So we have that guide for vetting your therapist. That's also there. And that's like super important. And in the course, I walk you through that guide and explain what every answer to every question should be. Because people like me and Kathleen are just spitting this stuff out every day without you guys even asking us. Because you got to be able to know if your therapist is informed. I'm going to check the comments.
Yep.
I'm done talking now.
So what I would say, I always encourage my fellow massage therapists, research is for us as well. We have not one, but two journals that we can publish research in. If you found something, if you found a protocol that works, definitely think of having a research, like a study, and you can write it. They have continuing education hours that you can learn how to write a case study or even a case series if you have a series of clients, and then we can get it published in one of our journals that will publish massage therapists. And that's the way. I had a surgeon friend of mine talk to me about that. Like, research is the way that we talk to each other, is through published journal articles. So the first thing I talk to a massage therapist and I say, if a massage therapist is kind of confused as what this manual lymphatic drainage, fortunately, as we go through massage schools, I think 2023 and beyond, it's starting to be put, you have a certain number of hours, and information about the lymphatic system is not only in anatomy and physiology, but you'll also get a little bit of hands-on MLD in class. I want you to go on PubMed if you have any confusion and you're a medical professional, you're a massage therapist, you have any confusion about what MLD is. All you have to do is go on PubMed and type in manual lymphatic drainage and pull up the research articles. These are published peer-reviewed journal articles that you can see what is actually manual lymphatic drainage. Not, you know, what you see on the internet, not what you see on Instagram, but what's actually published in the research. And this is what is so surprising to me, that someone would be confused when PubMed is here. PubMed is your friend. It should be your first stop. If you hear anything, any terminology that you're not familiar with, the first place I go is to PubMed to see what it is. Because plastic surgery, there's always new things happening. So I don't know all of the terminology myself. And so when I want to learn something, reading published journal articles is my first thing. And then if something about MLD, my teacher at Close is my second stop. If you take Close training, which is where I took my MLD and my CLT, my instructors are there to continue answering questions. And I've actually seen both of my instructors at conferences last month. So it's you want your teacher to be at these conferences for lymphatics, to continue to be educating, and someone that can be a resource from you and you can continue to learn from. I was very fortunate at Power Lymphatics. My teacher for the CLT was teaching at Power Lymphatics, so I could get like a little bit of a refresher and get really tight right on top of the proper MLD techniques. So that would be my other thing. If you're certified in MLD or you have a CLT, keep on going to our conferences and keep that hands-on work so we can keep our technique like super tight.
And I think that's the other thing too, is people don't realize manual lymphatic drainage is a technique. It is a skin stretching technique. And I break down in the course the science of the technique, like exactly what it's doing, exactly like there's an entire module on the lymph system and how the technique works so that you guys can understand, because there are, and this happens all the time, in my virtuals, I will go through all the trouble, find you guys a therapist, call them, you guys get in the room, and they're just doing this. And I'm like, what is that? You went to the school, you did the thing. How is that happening? I don't understand. So you guys as the client, understanding, like, that's why that whole module is there. It's all packaged up in a nice bow. I tell you exactly what your therapist should be doing for your body for MLD. So especially post-op, because you guys have so much swelling, it's super important that technique is the Vater style manual lymphatic strokes, is the actual MLD technique that is going to stretch the skin parallel, not into the body, not digging or anything like that, but the actual technique. And that comes from these schools, which is why I have the directories, because I've taken 3 different schools. I'm doing Close next year. I've already taken the 3 of the 4 top schools in the nation for MLD. I've done 2 courses from each school. We're finishing up Norton, because Norton's finally doing their cosmetic in September. So we're finishing up with Norton in September. But I purposely went to all of these different schools to learn what they're teaching. And every year I do a different school, 2 of their courses, because I don't need 7 MLD certificates and 2 CLT certificates, but I would like to know what everyone's teaching to make sure it's consistent so that I know all the different strokes that there possibly is for MLD, the science behind the strokes and why they work. Squeeze massage, incisional drainage, that's not happening at all. They're not teaching any of that. They're teaching, do this and fluid comes out. They're not teaching the anatomy of what's going on in the body. None of that is happening. And that's the point of finding a therapist who's certified. And even beyond that, you can find a therapist who's certified, but you as the client need to make sure you understand. And I get that everybody is not like Kathleen and I. med journal junkies, as I call us, who are at 4 a.m. deep diving into medical journals for fun. And they're heavy. They're pretty heavy to read, which is, again, why I break it all down in that one module, is so that it's nice bite-sized chunks. It's a 40-minute video. You guys know my videos. I give a lot of analogies. I make it very simple. It's all the anatomy, soup to nuts, from where the lymphatic system starts to where it ends. How swelling is created, how it goes into the lymphatic system, how the lymphatic system gets rid of it. The manual part of manual lymphatic drainage is us as the therapist manually engaging your lymphatic system, not pushing fluid. So that whole concept right there, I spend an entire module on, so that you can go to your therapist and be like, hey, I know stuff about MLD and how this is supposed to work post-op. And I know what I need for my body post-op. Do you know how to do the technique? Okay, yeah, the technique checks out. Okay, yeah, the sequence checks out. Okay, yeah, they know where the lymph nodes are. Okay, yeah, they know how to guide fluid and how to like guide the lymph system and where they're placing their hands and how they're placing their hands. You guys get all of that training in that course. I teach you all of that as the client, because there are so many people taking ACOLS courses, taking all these different MLD courses, taking online MLD courses that don't have that hands-on foundational, that don't have that anatomy knowledge from the courses that Kathleen and I have taken, and from the conferences that you and I are constantly going to, from all these different places, because they're not as active as we are. And that's okay, but you, recovering from surgery, need to understand all of this, and you're not going to go take an MLD course. That's why I put it in there. I didn't need to put a whole module on it. I could have just told you, hey, don't get the squeeze massage, do this instead. This is what it needs to be. But it is so important for you guys to understand what is happening, to know why we're doing things the way we're doing it. And then us as therapists, it's so important to know why we're still doing things the way we're doing them and what we could be doing better, what we could be doing more of, what we shouldn't be doing, because that's a big part of it, is what we are not allowed to be doing, what we can't be doing. And that all comes with really doing the research from the client perspective, from my perspective as a therapist, and your perspective teaching therapists. And you guys don't know where to start. So this is the first course. I am in the middle of creating the fibrosis course, the science of lymphostatic fibrosis. And actually, Kathleen, you'd be very happy about this. Every single module has like 20 links to medical journals on what is serous fluid, what is fibrosis, what is fibroids, because fibroids and fibrosis sound the same. What is the difference between them? What is the lymph system? What is lymphostatic fibrosis? The chemical composition of lymphostatic fibrosis. I am nerding the hell out creating this course. I have so many other things I could be doing right now, but I'm so excited about it. And in there, for you guys, is all of the medical evidence of, hey, this is what fibrosis is. This is how it starts. This is how it became fibrosis. And then, how do we get rid of it? How do foams work? What is chip foam? What is gray cell foam? Like, how do you use this stuff? Will just cupping work for fibrosis? I'm putting it all in there. Everything is could possibly be in that course. But I do talk about the science of lymphostatic fibrosis in the post-op massage course, because it's important. It's important to understand with the lymph system how that works and where fibrosis comes from, because it's part of the swelling journey. Fibrosis is like the wrong left turn on the swelling journey. That's like how I explain it. So in that course, that's also in there in the bonus module, module 6, because I just was so excited about it, I threw it in there. And then I decided to make a whole course about it. But you guys need to do the research, and I get the medical journals for somebody who's just trying to go get, surgery in Miami, and you're a single mom and you don't have the time to do all that medical journal research. Kathleen and I do it for you and make these videos. Kathleen and I do the research on the medical journals and do the TikTok and do the course. Like Kathleen has courses, I now have courses. Like, we put it together for you and then show you where we got the medical information from, because it's really hard to say do your research and then you're like, I don't know how, and then you pull up a medical journal and it's like 10 pages long of doctor speak and you're like, what the hell am I reading right now? I know, me too. I love it. It's like a second language to me. It just makes so much more sense than English. But you guys don't understand that. So Kathleen has her courses to break that stuff down for therapists. I have my course to break it down for you guys so that you understand it's not the same thing. Because we could tell you, go look up a PubMed article on MLD, and then you do, and you're like, what the hell am I reading right now? I don't understand what any of this says. What are they talking about anastomoses? What is an inguinal? What is an axillary? I don't understand. So I took all of that, translated it into English with analogies, and put it in the course. So there's all your research. Because that's the thing. We tell you guys do your research, and you're like, I don't know how, because nobody's speaking English. It's all of the good research is in medical terms. So I'm starting to do the courses to translate it. And the first one is about your massages. And Kathleen's courses do the same thing. She explains it in that way too, for the therapist side. But that's like the confusion around the do your research thing, that like we say it to you guys and you look at us like we have 5 heads. You got anything else to add? We got 5 minutes.
Yeah, pop your questions in if you have questions, or you can text us later with your questions. But this I love it. I think every time we get on and talk about this, every time it's on your podcast and then it's on YouTube, like 2 years from now, someone who's planning their surgery will, get exposed to this, and then they will begin to understand their role in being the client, which is the center of the client, the patient journey into healing. It's the patient that's at the center of that journey, and we're all advising you and helping you with whatever our area of expertise is, but you are really at the center and you are in control as the patient. And I want everything that I put out to give you the tools you need to have that peer-to-peer conversation with your surgeon, because you hired your surgeon. And when you are, battling these surgeons who have, 3 of them, and you're doing the consults, it's not only like, do they talk a good game? Are they going to give you the surgery? Bedside manner is very important. Technical expertise is very important. The availability and the price is very important. But also do you get the idea that they know what they're talking about with post-op? And it's not enough to have a surgeon that's super amazing with the result, but has nothing to give you nothing after, they put that last stitch in and then they're like hands off afterwards. You need a surgeon that is going to be able to explain to you how you can get any complications handled, that will keep on answering your calls, that will not ghost you, that knows how to have a peer-to-peer relationship with the people that are handling your recovery, that is going to give you some good advice, or if they don't know, that they can refer you to somebody that does. So I don't expect them to know everything about nutrition, but I expect them to not have a giant ego and tell you that it doesn't matter, and instead tell you, hey, I know of a resource that you can go to if you want this focused nutrition information. And the same thing with post-op care and everything else, like massages. Like, not that, that because they don't do it, it doesn't matter. But if you want to do this, here's what you watch out for. Here's who I think you should go to, and then come back to them with your results, with what happens to you in the massage, so you can help the next person have their recovery as a seamless and happy process as possible. So someone is asking, how long does a BBL last? She said
it's
2 BBLs.
Permanent. It's permanent. It's permanent fat, unless you're doing cardio and then your body eats it. It's permanent. Unless you sit on it and squish it and kill the fat before it becomes permanent. It's permanent.
Yeah, and sometimes people need 2 rounds. I've definitely had a lady that went to Skin and Skinnier, that she was on her round 3, and it was really good because she needed to build it up and
volume. Yep.
Have more fat in. But it is like a calories in, like it has to be calories in. You can't diet and then you think that the weight only goes away from certain areas. Like weightlifting will really help. The proper weights at the proper time will help to expand the gluteal muscle, which can make it look nicer. And the different weightlifting and different exercise based on where you want the fullness to be, like in the glute maximus, glute medius, glute minimus, you know, there's different ways that you can do exercises. So that's something you would get the advice of an exercise professional for that. But the fluff fairy is real. I've definitely seen it happen before on a client a year out. So
Yeah. And I think that's pretty much it. The last thing I want to say, guys, is your recovery is your responsibility. Please stop blaming your surgeons. They don't know everything. We do want to follow their orders on things, but that does not mean that you can't educate yourself. Like Kathleen said, you are in control, okay? This surgery is about you. You get to decide what surgeon makes you feel the most comfortable about what you're about to do. You get to decide how much research you do and where you do it. You get to decide what kind of massages you want to get and you need. And then you go to your surgeon and say, this is what I've decided. Vater style manual lymphatic drainage. Gentle, backed by science, gets the swelling out. Is this safe for me to do? Can I do this? But you guys are the ones that get to decide. You guys always, you do this thing where you're like, well, my surgeon didn't tell me. Well, your surgeon isn't going to tell you everything if you don't ask questions. They're not just going to throw a bunch of information out at you. You have to ask questions, but you have to have the proper knowledge to ask those questions. This surgery that you've been saving for, that you've done everything for, make sure you are fully informed and educated from proper sources, like Kathleen and myself, before you have your consult with your surgeon. Because they're going to do their job. They are an artist. They're going to do their job. Like Kathleen said, they're going to put that last stitch in, and they're like, chef's kiss, looks beautiful. Now it's your job to heal. Part of that is understanding why you need your massages for healing, who you're going to go to, who your surgeon recommends. And that's another thing. You're like, well, my surgeon didn't recommend anybody, and I had to Google you. Well, did you ask? Did you talk to them? Did you say anything about this? Why did my surgeon tell me about massages? Because either they don't know, or they don't recommend them, or they don't have anybody to recommend, or they're not sure. Well, why didn't you ask? Why didn't you ask? Oh, because I didn't know. Okay. Well, there's a lot of people online telling you get lymphatic massage, and there's me and Kathleen, and there's a whole course that teaches you about what you need after surgery now. So it is this should be like a big thing for you guys. You're going to have surgery. This should be, I want to know everything I need to know about how to make sure this heals right. Because I don't want to sit there and be scrambling, because I don't want to waste my money, because I don't want to waste my time. This should be, I'm going to binge watch Kathleen and Ashley, and I'm going to purchase the course and follow it step by step. She guides you through everything as far as your massages. I'm going to buy Kathleen's Plastic Surgery Recovery Handbook, read it on the plane. I'm going to print out the Vetting a Therapist sheet, and I'm going to go ahead and find the links and find a therapist. Then I'm going to talk to my surgeon during my pre-op, and I'm going to ask questions, and I'm going to say, this is what I've learned. This is the medical science that backs it up. Am I allowed to do this? Am I not allowed to do this? Why am I not allowed to do it? Because this is what it is. You want me to wait? Okay, when can I start? Okay, cool. I'm going to start my manual lymphatic drainage massages at 3 weeks after my drains come out, and I'm going to this person who is certified and licensed, and I used the vetting questions, and I know that they're doing the right thing because I learned all the knowledge from the course and Kathleen's book. I'm taking it with me. That's how it should be. Plain and simple. You have these resources. You have TikTok, you have Instagram, you have YouTube. You are the one who decides to wrap it all up into a pretty little bow, because you know I love my bows. You are the one who gets to decide if you want to be screaming in pain having fluid pushed out of you. You are the one who gets to decide if you want someone raking through your body with a piece of wood when you are a week post-op. You are the one who gets to decide what you need as far as your aftercare and who you are going to. And it is so much better that way, because again, in Miami, some surgeons don't let you do what you want, and they tell you you need to go get the squeeze massage done, and you do, but then when you come home, it is now in your power to do what you need and what you choose to do and what you decide you need. So again, none of this is good or bad. We're not like, oh, squeeze massage is terrible. Massage therapists practicing incisional drainage are practicing illegally out of the scope of practice. That is the one thing that is bad. Everything else is up to you to decide whether it's something you need or you don't need. Stop putting things as good and bad. Stop labeling body contouring as bad. Stop labeling wood therapy as bad. Stop labeling your surgeon and aggressive lipo as bad. Stop labeling all these things as good or bad. Is it a no for now? Is it a not for me? Is it a maybe later? Is it a when can I do it? But it's not a no, and it's not a bad, and it's not a shaming, and it's not all of that. It's illegal, allowed, and not allowed. It's what my doctor says I can do and what my doctor doesn't want me to do. It's what I decide is right for me and what I decide is not right for me. It's what medical research is there and what medical research is not there. And that is the point of everything that Kathleen and I do and the point of these videos. Done. We are ending it on that note. But also, guys, we asked you guys to ask questions all day. Nobody asked questions. Is there anything that we missed in here? Hold on. Let's scroll real quick before we end. Do you see anything?
I think
Is sitting a few minutes within 6 weeks BBL, is that safe? It depends. That's a surgeon question. Does your surgeon allow you to sit? Did they say you were allowed to sit? That's going to be one of those things we got to talk to our surgeon about, because certain surgeons have different rules, right? So some surgeons are like, oh, you could sit after a week, you're fine. Some of them are like, don't sit for 2 months. That's something we have to ask.
And I think it's different to sit for 10 minutes 2 days after surgery than to sit for 5
6
minutes
weeks.
on the couch, like at 5 weeks and 6 days. So
yeah,
it's
very dependent.
It's a very big window you gave within the first 6 weeks. So yeah, but that would be something that you could easily and for free, and they would love to talk to you. Like if you had a good surgeon and they didn't ghost you, they live for these questions and they want to discuss and share why, because surgeons have good hearts. They want you to have the ideal result. They want you to ask them the questions, the surgeons or their nurses, and they want to be there for you. They came into medicine and did all these long hours and all this long fellowships for a reason. It was to help people be the best people that they could be. And they chose plastic surgery. So every time I'm always like, just pick up your phone and send them a text. They are willing and eager. So many surgeons give their, personal numbers because they want what's best for you. We all want what is best for you.
And you guys, if you did, because I'm on the flip side of this, Kathleen, none of the surgeons out here are doing that. And you're getting ghosted by the office manager, you're getting ghosted by the nurse, you walk in with questions, and they're like, oh, just give it time, you'll be fine. And you're like, what the hell do I do with that? I need help. Because I'm on the opposite end of the stick out here. If that is the case, have your primary check you out. Go to your doctor. If you went to Miami and you can't know who your surgeon was, your surgeon won't see you, you're never going to see him again in your life, and you did get ghosted, go to your primary care doctor and be like, hey, I had this done. This is the science of it. This is what's going on. What do you think? Your doctor. You take care of my body. What do you think about it? Because it sucks, but 90% of my clients are ghosted by surgeons every day. They don't have anyone, which is why they have me, my videos, my course, like all of that. If that is the case, you guys do need to find someone that is medically inclined. And I'm not talking about, somebody actually brought something up. I think it was one of your comments, Kathleen. In New Jersey, nurses aren't allowed to practice unless they are under a physician or something like that. I saw something like that in your comments. And I was looking into those laws today, actually. They can't just be like, oh, I'm a nurse, let me pull your drains. Like, let me come to your house and pull your drains. Wait a sec. We got to look up some laws. Hold on. Let me look up some laws real quick on that. But you guys need a doctor. Either your doctor or go to the emergency room, and whatever surgeon is there, you will find a surgeon, someone to help you to figure out what's going on. Maybe not to call and ask about your BBL, but you can still email, text, call, try to get an answer. There are a lot of surgeons that have apps now where you can ask a question on the app and someone gets back to you. Like, you guys have to at least try. Don't just think, oh, because I went to Miami, no one's going to answer me. You don't know that. Did you try? Did you call? Oh, no, I didn't have time. I didn't call. They're not going to answer anyway. What? You didn't even try. What do you mean? But if you don't have somebody like that, you've got me to be like, okay, well, go to your primary because I'm not a doctor, but also let's see. BBL, how is it feeling, right? How swollen is it? What does the fat transfer look like? Are you sitting with a BBL pillow? How does it feel? Like, I'm not going to be all like touching it and stuff, but I will have you touch it and be like, okay, where does it feel firm? Where does it feel soft? Where is it pain? Where is it tender? What is the level? I can guide you through helping you figure it out. That's the point of what Kathleen and I do. But we're not doctors. We're not going to tell you. We don't know. We're going to say, ask your surgeon. You're going to have to ask your surgeon. And if you are ghosted, which my people a lot of times are, then you got to find somebody who knows swelling and knows what they're doing. So go take the course. Link is in the bio. But or schedule a person consult with me in Jersey. Come to Jersey and I'll help you out. Or go to California and see Kathleen. She'll help you out. But it's all up to you guys. That's the point of this. It's number one thing. Squeeze massage and incisional drainage is illegal for massage therapists to be doing to you. It violates our license. It is out of the scope of practice. That is not allowed. And estheticians, not allowed at all. Boom. Done. And then, Kathleen, you got anything you want to promote? Just booking courses?
I will be speaking at ISL in Geneva, in Italy, in September. So if anyone is going, if you're interested in the body's lymphatic system, this is the World Congress. This is the big show. So I invite you to join me in September for ISL. It's the 50th year that ISL has been in existence, and we expect over 1,000. Dr. Campisi says he expects over 1,000 people to be there. That just the top knowledge from around the world. So if you are serious about the body's lymphatic system, if you're a professional, I highly recommend that you come and join me. I'll be talking about lymphedema awareness, and I'll be talking about stress reduction and lymphedema for our lymphedema clients. So stay tuned. If that is your passion, I will have more information coming out on that topic over the summer. If you want continuing education classes, I have online continuing education classes with Nick Timba. I'm a Nick Timba approved provider, so you can get CE from them. And if you're a client, if you're a person who wants surgery, also go onto my website. I have free little like mini classes you can look at. So there's something for everyone, something for the therapist and something for the person planning surgery on my online classes. Yeah, but the big thing is going to be ISL in September. I'm very excited for us to all get together, and I'm looking forward to seeing some of you there.
I'm going to be in the Norton course.
Yay!
It's the only time they're offering it in New York.
Perfect.
my second Norton course this year. Ooh. Yeah, so online course is now launched. I know the last time we spoke, I was like, yeah, in the middle of doing it. So the course is post-op massage and finding a therapist. I literally walk you through, like I handhold you step by step. Okay, here's swelling. Here's how it works. That's the first module. The second module is What is the lymphatic system? Because that's what's responsible for getting out the swelling on a regular day, all the time, 24/7. What is the lymphatic system? How does it work? Okay, module 3. Where does the lymphatic system have its problems, and why is swelling not going down after surgery? And then module 4 is manual lymphatic drainage massages. What the heck are they? What are they not? I have a whole section on what are they not, what to look for when you're looking for your massages, what it's supposed to feel like, how long it's supposed to last, where they're supposed to be massaging, what the sequence is supposed to be like, how it's supposed to feel. Everything is in there. Module 5 is how to find a therapist. So that module is actually really cool. That was an extra thing that I added. What the licenses have to be in order to touch somebody in your state. That is the first thing that needs to happen. Second thing is the schools that we need to go to get certified. Third thing is the courses that we take and what they entail to get us certified. So what are we supposed to know, right? What are we taught in school? And then the last thing is, how the heck do you find us? So vetting questions to ask your therapist, those are included in the course. But there's also the add-on of the printout PDF. It's a downloadable PDF. It's got all the clickable links, so you can just click right there, ask your therapist questions, and you're good. You don't have to worry about hunting for the websites for all the schools that are licensed and certified for therapists. And then the last module, bonus module, that was like a total, I recorded a video and then made the module because I just like had lots of fun and did too much. And I was like, oh, we need to expand this a little. So in there, we talk about compression. In there, I have an entire section on the science of fibrosis and how it's a straight left turn off the normal healing path from swelling, how it's created, how to get rid of it, your post-op supplies at home, what doesn't work for your lymphatic system and your swelling, the things that you guys hear on TikTok and you're like, oh, I need to buy 1 million of these after surgery because I'm having surgery. I need to go buy this thing because somebody said it's good for surgery. I need to go get a giant gravity chair and cut a hole in it, and somebody said I could use that for surgery, and that's the only thing I'm allowed to sit in. All of those like at-home buying things where you're buying tons of supplies and you're like, I don't know how the hell to use this, and I don't know if I even should be using this. There's an entire part in the course about that. That's the bonus module, is all the post-op products you actually need medically that work for your swelling, and all the things that will cause you to swell at home and will cause more pain at home and will cause all the problems that don't work for swelling. And that's module 6. So actually, I was waiting to the end to say this. So our course has been launched for 3 weeks. The link is in our bio. As of Monday, or we'll put it up on the stories. It might actually be as of tomorrow night. It's $250 right now. It's going up to $275. So definitely by Monday, the price will be increased to $275. It's 7 hours of content. You guys can get it now for $250. The link is in the bio. The add-on PDF is $30. That's also going to go up in the future, but right now it's $30. The course is $250. So link is in the bio for that. It will be going up soon. I'm going to delay it a little bit because this video is going to go up on YouTube this weekend. I'm probably going to post this tomorrow actually to the YouTubes, so you guys can watch the full thing. And then the course price is going to go up definitely by Monday. So there's that. We have our online shop. So in module 6, all the supplies that I explained to you guys that you need to make sure they are medical grade supplies and not some weird memory foam pads from Amazon that have no name on them and they're not medical and ew, gross. We have all of the post-op like medical grade supplies that are for post-op, that are meant for post-op, that are just weird supplies you're buying on Amazon. In our post-op shop, the link to that is in our bio. Each product page has a video where I explain the product, why it works, why you need it, how to use it, all that stuff. And then I do virtuals, but you're honestly better off doing the course. Everybody's been doing that instead of the virtuals because there's it's 7 hours of everything in a 45-minute virtual. So our virtuals are for you guys to ask me questions specific to your surgery. We are not going to spend time in our virtual, which is why we have the course now. We are not going to spend time in our virtual with me sitting there and calling therapists for you when you have an entire course and a PDF resource to do that. I can do the same thing you can do. Because here's the problem, and this is also why I made the course and the PDF, which actually it was supposed to start with just the PDF, and then it came a whole full-blown course. But the point was, I tell you guys what questions to ask. You call and you ask, then you get there, and it's a totally different story. They're doing things completely different than what they said they were doing on the phone. I vetted them. I said they were good because of all of the things that they said right. You got in there, and it was a different story completely, and it was a giant problem. And now you have massive swelling everywhere. It just undid all the work that we did through our virtuals. If you are booking a virtual with me, it is for something like that question we had where it's, I'm kind of in between 6 weeks. Can I sit? I don't know. Or I have fibrosis and I don't know how to get rid of it. Or I don't think my massages are going right because I've gotten them and this is the problem. Or I don't know what to do about my garment. Can you help? It's for a specific question. That's what the virtuals are for. For the entirety of all the things you need to know, that's the course. For preparing for surgery, that's the course. For after surgery, when you guys are like, oh, I don't know what to do. I don't know about anything about the massages. I don't know how to find somebody for my massages. Who do I go to for my massages? I just put up an Instagram graphic with all the questions that you guys ask me and try to get a virtual for, and then we wind up spending time talking about all of it, not addressing any of the important stuff with your recovery. All of that, that's the course. For specific questions pertaining to your recovery, that is our virtuals. To set up a session with me, either in New Jersey, where I will do the hands-on MLD and answer your questions at the same time, or for my virtuals. So we're in Jersey, Highland Park, and Elizabeth. Virtuals are virtuals. They are held only on Fridays. Call the office, 732-841-0142. Happy Alex will be happy to get you set up with an appointment, as she is always sometimes annoyingly happy. I got to get her on a live. I got to do that. I know we've had it on the calendar on our Friday morning meetings forever. Maybe I'll do that tomorrow. Just so you guys can meet her and she can like talk about the most common questions that she answers during that initial phone call. So we can like explain those to you guys and have it to live on the interwebs forever so she can stop repeating herself forever. But that is that. So the link to our post-op shop is in the bio. The link to our course and that Vetting a Therapist PDF is in our bio on the Instagrams. It is also, I think there's a link to it from the post-op shop. There's also a link to it from our website. It's everywhere, but just go on Instagram, click the link in bio. On YouTube, it is in the description box. On podcast, it is also in the description box. So it's all in the places. Kathleen has her stuff link in bio, so you can find her stuff. This video will go up. The snippet of this will go up Friday, tomorrow, on the Instagrams, or Saturday on the Instagrams. And then the full video is going to be living on the YouTube. So check us out on the YouTube. I will also send this to you, Kathleen, so you can make it live on the YouTubes. Oh, question. Do you know when our podcast with Dr. Williams is coming out?
Yeah,
All
you
right,
have to
guys.
ask him. They're working on the whole season. I felt
know.
like I got the and they want to have the whole season in the can before they put it out.
Yeah, I figured. All right, well, we'll let you guys know, because people have been asking me still about that. We will let you guys know when that happens. You will all be informed in some way or another.
And feel free to contact him directly
Yes.
with your questions about that, and then he'll get an idea of how many people want to listen to it.
Yeah.
So that would be good.
Yeah, that's actually a great idea. Stop contacting me. Contact Dr. Williams, because Kathleen and I don't have the podcast. We don't have a copy of it. But his staff is amazing. So yeah, if you guys want to see the podcast that Kathleen and I did with Dr. Williams about post-op massage, about all of this, contact Dr. Williams. Check him out and he's amazing. He's just follow him anyway. He's fantastic. I love him. But yeah, I tag him in a bunch of my stuff, so he's all over. Good night, Miss Kathleen. I adore you.
Bye.
Adios.
Thank you, everyone.